how the patient advocacy community can begin to include cancer survivorship in the writing of national cancer plans. So your comments here may be useful. We don't have a lot of time left, but it's a general question to throw out to all of you now. How do you take the survivorship issue and get it as an agenda right in there with your national cancer plans that vary across countries?
Well, in the UK, we actually have that taking place. We have the National Cancer Survivorship Initiative, the NCSI, which is actually embedded in the National Cancer Plan, and which is a very, very detailed program of improving survivorship issues for cancer patients. So I'm not blowing our own horn, but if anybody wants to see how the UK has approached it, you can Google NCSI or National Cancer Survivorship Initiative and see the project, how it's going on.
For the last few years, we've been working on a project looking at national cancer plans and what are the roles of cancer leagues in terms of being involved and involved in the development and implementation of national cancer plans. And what we found was that a lot of the cancer leagues provide direct input into the national cancer plans because the leagues, they work directly with the national ministries, with the ministries of the country. So they have, oftentimes, in many of the countries, they have very good collaboration, and they have a very good relationship with them. And in turn, the cancer leagues in the countries they also work with the patient organizations. So one suggestion I would have, Selma, is for the patient organizations to work with the cancer leagues in providing input into the national cancer plans. Now, if I could just go ahead and take just very quickly a few minutes to talk about the European Partnership for Action Against Cancer, because this is an EU-funded project that just started this year. It's going to end in it's going to run into 2014. And one of the main packages in there is on national cancer plans. So we're involving national ministries in the discussion of national cancer plans and what can be made better. So here we go, a great opportunity for all the cancer patients who are here, the organizations representing patients, to go to their national ministries and say, we know that all the EU countries are involved in the discussion for the European partnership, and we would encourage you to look and see how we can be more involved in providing our voice into the national cancer plan discussions that's happening at the EU level.
Just to say that these problems of survivorship are very important, and probably medical oncologists should shift from focusing on the early diagnosis of relapse to dealing with the actual problems of survivorship, so the later effects of therapies and so on. In principle, however, I think we should also recall that 1/2 of cancer patients are cured of their disease. And the risk of relapse may not be 0. But this doesn't mean that a patient is cured, because my risk of having a myocardial infarction in 5 minutes is not nil. But before having it, I'm not sick. So when the risk of relapse is so low that it's lower than many other risks of living, the patient is cured. So understanding this point is very important. It's very important for the patient, first of all. It's important also for employers and so on, because clearly, we are dealing with 1/2 of cancer patients who are cured, and maybe they don't know that they are cured just because they have a residual risk of relapse.